So it's good talk. So next we have about 20 minutes. So one thing I can do, I prepared one slide for general discussion, but before the general discussion, I would like to present my talk a little bit because we skipped my talk, 10 minutes talk. But my talk is more general. Actually, it may initiate some good discussion. Let me share my screen. Okay, can you all see my screen?
Yes.
Yes.
Okay, I'm going to start with my talk. Okay, so you can see my screen, right? About the overall slide. Yeah.
Perfect. Yes.
So I want to introduce our vaccine knowledge base violin, which is now again supported by the U24 grant and the MPIs, including me, Tree, and Jan Cook here. And also I want to propose a new initiative. We call it Vaccine Informatics Working Group. So it will be in the end. So first of all, introducing the violin vaccine resource. So it was initiated 2007, and later it was funded by NIH with an R1 grant to me. So this is a website. So it was developed initially to address the issue, the bottleneck that there was no comprehensive vaccine resource for vaccine research purpose. And then the goals of the project was to collect, annotate vaccines, vaccine components, and the vaccine mechanisms, and develop tools to support the vaccine research, such as vaccine design. And then, in addition to the early R1 grant, later we have also been funded by some other small grants here or there, and then later by the UH2 grant, together with Dr. Guanmin Wu. So he is a major developer of the reactor database. So we basically focus on pathway and networks. Yeah. And then later we have now the U24. So yeah, the title actually for the violin we changed a little bit. Yeah. So violin now the new name is Vaccine Information and Ontology Linked Knowledge Base. So again, it's for us. But originally the violin means vaccine investigation and online information network. So we have a lot of programs there. This is just some illustration. And we have over 4,500 vaccines for over 200 pathogens and also non-infectious diseases, such as cancer. We now have hundreds of vaccines annotated for cancer. So we have about 2,000 pathogen genes and over 2,000 host genes. So we manually annotated thousands of peer-reviewed publications, more than 4,000 peer-reviewed publications over the many years. So this is more the general relations. So we have vaccine, and the vaccine has some formulation. So it can be some protective antigen. So we have its own database, protective antigen database, protein. We have adjuvant. We have some other formulation as well. And there are some subtypes of vaccines, such as the DNA vaccine or live attenuated vaccine, or you can call it licensed human vaccines or veterinary vaccines. And then you can have the host response, right, against protects host against some diseases. So it can be infectious disease or cancer. So, and the host can stimulate some vaccine-induced responses. So responses can be cell-mediated responses or antibody response. Eventually, all the responses come to the protection. Yeah. So since this is a vaccine ontology, this is ontology conference workshop, we want to just emphasize our vaccine ontology. So it's definitely there, has been there for a long time, and we have many collaborators working on it. This is more like a portion of the list, and we now have many new like Chui and Jiangguga and Jie and a lot of others, yeah, to working together. So this has been included in the OBO Foundry, the Open Biomedical Ontology Foundry Library. So just give you some example of how VDOS ontology has been used. So it has been used by many. For example, the vaccine adjuvant component is an intramural NIH program. So basically, they have all the new developed adjuvants into database, and then they contact me, the PI contact me, the Wolfgang contact me, and say, okay, for each adjuvant, right, we need to have a vaccine ontology ID. So, and we have been collaborated for a couple of years, and now we have hundreds of vaccine adjuvants. They are all having vaccine ontology ID, and I think it's very important to be standardized this way. And we agree. And another example is the Human Immunology Project Consortium. They also, for each vaccine, they put the vaccine ontology ID there, and then import shared database. And they also use vaccine ontology to categorize their studies. So this is important. Yesterday, I gave a talk in another infectious disease ontology workshop. Yeah, I presented some more detail on how this can be done more efficiently to support vaccine data analysis. So just because it's just a limited time, I just go quickly. And now I just want to say about our U24 grant. So we have 4 aims. So the aim 1 is to implement a pipeline for automatic knowledge harvesting, standardization, and integration using advanced informatics technologies. So we can see actually several talks here are related to our aim 1. And then aim 2, so aim 1 is more technology development. Aim 2 is more like the content, the science content. So it's to use the pipeline technologies to expand the vaccine knowledge base, and including the vaccine ontology, of course, and the management. So we focus on some specific domains, including vaccine development, protective responses, and then vaccine safety. And so it can be basic research, right, or translational research or clinical research. So vaccine domain definitely covers different areas from basic to clinical trial to after the trial, right? The vaccine safety after the vaccine has been used. And then we also protect, the aim 3 is to provide a VIOLIN 2.0 knowledge-based viewer, improve the website and improve the query and the use case showcase and use cases. Then the aim 4 is outreach and community engagement, and we always think the community engagement is a key to the success of the project. So then now I want to say we want to have a new initiative here. So we call it the Vaccine Informatics Working Group. So vaccine informatics is an emerging field. Well, in 2010, actually, we also say it's an emerging field. Like emerging vaccine informatics. So we had a 26-page review article with Dr. Rhino and Annie and Robert. Rhino Rapoli is very famous pioneer. He's a pioneer in the invention of the so-called reverse vaccinology. So Annie de Groot, she's a founder of the LPVax and has been studying the so-called immunoinformatics for a long time. And Robert Chen is the developer. He developed the VAERS, the vaccine adverse event reporting system. So he was the founder of the VAERS system. So we published a paper there. So here we think we can use the same term vaccine informatics to label our working group. So we like to build up such a working group to do many things, such as working together, right, for ontology development, updating, and applications. And then for tool development, like machine learning, to help ontology or use ontology to help tools. And then we can also work together to build up some minimal information standards. It does not have to be ontology or tool. It can just be more like a policy level and a standardization level. So it has been a very useful platform to build up community understandable certains. And we can do other things together. So we think we can organize many activities in these areas, and we also can organize maybe some regular Zoom presentations. Right? Today, I think our presentations, are all very good, right? And we enjoy the discussion. I enjoy a lot actually for all talks and discussions. So maybe we want to do it more regularly than just once a year, right? Maybe we can do it monthly or bi-weekly, or even just organize some smaller working group to present more kind of closing working together, right? So I think this is kind of something that we are actively planning. We have planned for a while, actually, for a few months, but I think it's about ready. So we have some ideas, very concrete idea. Yeah, please let us know. Let us know. Let me know if you are interested. So this is my email, my website. Okay. And this is more for the general discussion. So basically, I just put it simple. It's more like how to use machine learning to evaluate ontology, right? And we have several talks about this area. And another one is how to use ontology to best support machine learning. Like, can we use ontology to support drug-drug interaction or vaccine design? So, and another one is how to achieve wider community collaboration, like our working group that I proposed earlier, and what's more, right? And then another one is what to expect for next year's VDOS. Okay, so that's all for me. Okay. Or should I keep sharing the one? Yeah, thank you. Any comments, any questions? Maybe I can share this one. Okay, we have 10 minutes.
Yeah, I think it's definitely worth discussing about, the first two bullet points. I think are very important, right, to the ontology field too. Because with the large language model coming up, we need to think about how to leverage that, right?
Right.
Yeah.
So, yeah, because, again, before I noticed, people talk about using machine learning, right, to evaluate and enhance ontology. So definitely theoretically it's possible. But however, I don't see bigger breakthroughs actually in the last decades. But definitely there are some. Like for example, last year, Li Chung's group, like Rashmi, they have presented some method to identify some missing information or missing links in vaccine ontology, and in this meeting, right? So they presented more actually. Wonderful talk about using the SNOMED and NCIT as the example. So this is coming together, and we have others like the DDI, right? The drug-drug interaction identification. Those things and several studies talking today can be used actually to evaluate and enhance ontology. So I just feel like it's coming, right? Especially with the large language model, it's coming along, and so we should capture the wave, should capture the trend, and with more technologies coming together, probably we can do more to use. And how, if we can get a better ontology, then coming back, like how to use ontology, right, to better support the machine learning, right? How to make how to make data AI readable. I think that's something ontology can help. Okay. Any comments?
Well, just I think I agree with the fact that we should think more on how to use the machine learning as well as the large language model, as we see in the presentation with the drug-drug interaction. If there is a way we could infer, we can use that kind of approach for the vaccine, and not for the vaccine, could be for the vaccine interaction, but could be for associated mechanism to the vaccine, like, mechanism of action or something, additional information that we can gain through the LLM approach. And I don't know how, but I think we need to take in account that there is ChatGPT, and besides whatever issue as ChatGPT, as the good things that we if we can use, could really be able to improve and what we are trying to do in the vaccine context. So I think we should kind of think in the future, or near future, to kind of how to use that for the vaccine, for improve the vaccine ontology, and the information that will be covered by the vaccine ontology, and how to implement,
Yeah, it's a good point. Any other comments?
Yeah, I like all the talks today. It's so good. And also, I just think it's a lot of efforts that say how can machine learning things can help the entire development. I think it's very good because I'm the entire developer, so for many years I found that it's kind of very hard, to develop the ontology and then make all the logical actions correctly. And I just say if we have the tools, it's probably can speed up the ontology development. And also the other ways is for the biomedical ontology already, developed over 20 years, and then many ontology is become good and contains a rich, logic actions. And also how we can take advantage of those logic actions in the machine learning stuff is also, kind of the things we need to thinking how we can, it can do the other way. I just thinking is ontology and the machine learning, how can the machine learning can benefit the ontology development, and also for the what the information in the ontology can help in the machine learning to solve some biomedical, issues. Yeah, that's something I think we need to work together and then to improve this area.
I agree, Jamie. We always see the reverse, like, how the machine learning helps to develop ontology. That I think is a good thing because, as you said, require a lot of effort to do it. But I think that the reverse could be even as much interesting to try and see.
Yeah, that's a good one. Yeah. Okay. So yeah, we only have a few minutes. So maybe we can discuss the last question is like what to expect for next year. So anyone would like to give any comments? Or I don't know where next year, where the ICBO meeting will be.
In the USA, I think, is 1 year outside and 1 year in the US.
Okay.
If I remember correctly, so should be in the US.
Okay, it must be some place in US. That's good. So it's probably easier to attend. So I still remember last year it was in Ann Arbor. I was the local host for this meeting. It was wonderful. Yeah, definitely. We would like to have more social, right? connection and discussion. Yeah. So, but today, I mean, I feel like today's my impression is today's the presentation quality for all of the presentation, all talks, actually, it's quite good. I don't know what you guys think. It's quite good. I like it. Yeah.
It is very good, and I think we should keep interacting with the work that has been presented here, and continuing this discussion outside, this workshop, because I think there are a lot of things that have been, integrated together. And in particular, we have the view of the vaccine ontology that I think that will be really helpful, not to lose the moment that we have here, and trying to continue in this discussion. So I don't know if through whatever method, if creating a group or calls, but I think we should kind of keep track and see how we can be more interactive one with each other. Because I agree with you, they were a really good presentation, and we'll see a lot of information.
Great, thank you. Yeah, yeah, definitely. We will. I think we will kind of release. Yeah, because everyone agrees, right? We'll release the videos for individual talks to YouTube later, so people can. Yeah, unfortunately, this time they don't allow us to advertise our workshop to the wider audience. So only you need to kind of, even just listening, you need to register. So it actually reduces the number of potential attendance. Yeah, but overall, I think it's good. Yeah.
I just have one question. Is that possible that the presenter also shares their slides? Because I just say, oh, the talk is really good. I do want to, to listen that again, and then, to look the slides as well.
If I may offer a suggestion, would it be possible to put have violin serve as repository for all the VDOS conference slides?
No, it's not violin. I think, yeah, unfortunately, thank you, Anthony, for the offer. We do have the VDOS. We do have the VDOS website. We can put there. Yeah. So maybe each presenter can send us, right? Send any of like Yongqun, Tree, or me, any us, or there's some ICP, or there's some easy chair, and just send to us, and we will include your slides in the VDOS2023 website, and then we will do some work and to make a separate videos for individual talks, and then later we like to send it to YouTube, and we will let you know. Okay.
Yeah, we can use VDOS GitHub, and if anyone agrees to share their slide, yeah, please send to us, and I think we can make them available. And I think one thing, I don't know whether you mentioned, we have kind of Slack for the vaccine informatics. So I just typed in the URL in the chat, so if anyone can join. I think some of you are already on board, but if you're interested, please join.
Yeah, great. Okay, so any last minute? Anything else?
Well, Oliver, shall we talk about the journal special issue?
Oh, yeah. So the journal, yeah, we have the journal Biomedical Thematicus. So we have already applied. So maybe let me share my screen to make sure you understand where to get, right? So for example, it's actually quite easy. So for example, you go to here, you can just search a journal of Biomedical Thematicus. Journal of Biomedical Semantics. Where it is. It's not working. Yeah. So, okay, here. So you come to here, right? There is a collection here. So you click the collection, and the vaccine and drug ontologies, yeah, is right here. So you can click here, and you can just follow the instruction, and you can just submit. When you submit your paper, well, before you submit, you have to reformat your conference paper, right, to journal format, and then you can just follow whatever the journal asks, right, and then you can submit. When you submit, make sure you select the vaccine and drug ontologies 23. You select this one, as your more like a special collection, and then because only after you select this one, they will notify to us, and we will handle it, right? So we will probably make it faster to process the one for you. I think we may also get a 10% discount. I was asking them if published in this one, can we get a 10% of discount in terms of publication fee? I need to confirm with them. It appears like they agreed, but I need to confirm with them. Okay.
Okay, and is there a deadline for this submission?
That's a good question. Yeah, we haven't set up deadline yet. Should we set up some deadline? What do you think? When do you think you can make it? Look here, or maybe 2 months? What do you think? 2 months enough?
Yes, I think, but depends on the others.
So if we see 2 months, right? It will be then it's October 29th or end of October. What about that? I mean,
Yeah, I
you can
think
submit earlier. You don't have to wait
Yeah,
for that
exactly.
long.
we can make that final deadline, but it will be rolling based. It will be reviewed rolling based.
Yeah, so it's rolling based. Yeah. Okay. Okay. Yeah. And then, yeah, we definitely expect you to continue to submit and present in next year. So for sure, if in USA, for sure, I plan to attend in person, and we look forward to see you there. But otherwise, yeah, if you like to be our vaccine informatics working group, you may also let us know, right? And we'll include you. And we're now kind of accumulating our list now. So we will send out some invitation and quickly moving on. Yeah. Okay, that's it, right? Yeah, it's very hard to say goodbye. So yeah, thank you all for coming, and we look forward to our continuous communication, and look forward to next year.
Right.
Thank you very much.
That's good.
Thank you.
Thank you.
Thank you.
Bye.
Bye-bye.
Bye.
I think you can end the recording now, Oliver.
Mhm.
I think you can end the recording now.